Welcome back. We just got new information about the measles outbreak in parts of the Southwest. Officials confirmed an unvaccinated child died in West Texas, the first death since 2015. Now, public health officials say declining vaccination rates could be behind this sudden surge. The number of confirmed measles cases reported in West Texas is now at 124. The CDC said 25% of measles cases so far this year have resulted in hospitalizations, with kindergarten vaccination rates dipping nationwide. More communities may be at risk of those outbreaks.
I think that this is going to get into the hundreds of cases and could take many months to try to fully snuff out. And when you have that kind of a concentration of measles within a community, it's going to inevitably spread outside that community.
The CDC said the disease is most dangerous to children under 5 years old and can cause a rash, cough, and a high fever. 2 doses of the measles vaccine are about 97% effective at preventing the virus. And joining us live to talk about the drop in childhood vaccination rates from the Partnership to Fight Infectious Disease, Candace DeMatteis. Candace, good morning, and thank you so much for being here with us today.
Good morning, and thank you for having me.
Now, I know we mentioned just off the top here, kindergarten vaccination rates dipped nationwide. What is behind that drop in younger kids?
Well, we're seeing a lot of reasons. Despite this recent outbreak that's reminding people how dangerous these diseases are, vaccinations have been a huge success story. And so we don't have that memory of what those diseases were like when they were spreading more rapidly and more freely in communities across the United States. Vaccination works. So what we're seeing is that, as our collective memory is that, the diseases aren't really, present, we concentrate more on, well, are these really needed? What are the risks? You lessen the benefit, you increase the risk, and you forget about the risk of the disease. And so we think that has a lot to do with it. And then also during COVID, people didn't have access to providers, so we got behind on childhood vaccinations and still have not caught up in many communities.
So you've studied a bipartisan poll that gathered Americans' opinions in vaccinations. How did the majority of Americans react to this drop in childhood vaccinations?
Well, we saw that 69% of Americans are very concerned about the drop in childhood vaccinations, and the majority of those polled also support mandates. I know that may not be as popular, and particularly post-COVID, but we saw in our polling that people do still support mandates, especially when it comes to children and protecting children.
Well, I know there's a lot of controversy behind this. We've heard it over the years from many people, outspoken celebrities and our government even. What would you say to those parents? Do you think that they should instead have the parents have the choice, or this should definitely continue to be a mandated thing? How do you counter that argument?
Well, the challenge is that many people say, well, if I choose not to vaccinate, why do you care and you choose to vaccinate? The vaccination works, you should be protected. And we see that in this outbreak in the Southwest, as you mentioned. But still, there are a few people who were vaccinated who will contract the disease. A highly effective vaccine, 97% effective. 3 out of 100 people may still contract the disease. So it is that community immunity that we're looking for. And then you also have people, because they have an underlying health condition, a cancer, for example, undergoing cancer treatment, an autoimmune condition, that they may not be able to get vaccinated, or the vaccine may be less effective because their immune system is suppressed. And so, having a widespread vaccination protects all of us. Those people who can't get vaccinated, those people for whom the vaccine may not be, it's not 100% effective, but it prevents the virus from spreading. And collectively, that's why we need such a high vaccination rate.
And what impacts will you see if we don't keep continuing to increase this vaccination rate? Are we already seeing some of those big impacts right now?
The outbreak is a great example. Measles is one of the most infectious diseases we know of. If you have a person who has measles walk into a room with 10 people who are unvaccinated or otherwise not immune, 9 out of those 10 will get measles. That's how infectious it is. That's why high vaccination rates are so important. And the vaccine is highly effective and very safe.
Yeah, and most importantly, we're having this conversation now. We're talking about it and continuing to educate people and give them the more information they need to understand vaccinations and what they mean to us. Candace, thank you so much for being with us today, and we hope to speak to you down the road.